Setback otoplasty is the formal term for this surgery, meaning that somebody has prominent ears and the goal is to put the ear closer to the head. Now there's two main reasons why the ear can sit further from the scalp. One is that the antihelix has not formed. So if we look at this ear, this is called the antihelix. If the antihelix has not formed, you don't have this structure, anatomic structure on the ear. And this looks very flat. And the goal of the surgery is to create that curve. 95% of people who want their ear pushed back don't have a very well-formed antihelix. And the goal is to recreate the shape of that cartilage. 5% of people have the entire ear sitting, so they have a nice fold here, but the ear actually sits far from the scalp. And so the goal of surgery there is to bring the entire structure of the ear closer to the head. It's rare that somebody would need both procedures. It's possible, but it's rare. It's one of those conditions that brings a lot of pain to people. And the reason is that anything that's above the neck, it can't be necessarily covered. And if there's been teasing in the past, which is usually where the pain comes from, people really notice a big difference in their lives after the surgery is done. The telltale sign for me that the patient has been happy with the surgery I've done is when they cut their hair, when I see them back in follow-up. And if I see that they haven't cut their hair, I really have to spend a lot of time talking to them and finding out what is it that they're not happy about. Most of the time, the results of the surgery are great, but the internal pain that came from the teasing of the past and the self-consciousness that they've had about that feature of themselves is so deeply ingrained that regardless of what the physical outcome of the surgery is, that they still don't feel comfortable showing that part of their body. The scars for this surgery lie in natural creases or folds behind the ear. So if I'm doing a setback on the antihelix, I put the scar in the reflection in that fold. If I'm setting back the concha, then I put the scar closer to the head so that scar is invisible. The historic way of doing otoplasties at the turn of the century was not even doing anything to the cartilage and removing skin. And what happened over the years was people continued taking away skin even though they were doing things to the cartilage. And the danger in doing that is that then you can have bad scars. So if you get something like hypertrophic scarring or keloids, that is a disaster. I feel very strongly that skin should not be removed when this surgery is done. I would say the most common complication after this surgery is whether the ear comes out again. The recovery is about a week. So after surgery, they have a big bandage on their head to protect their ear from being pulled forward when they're sleeping and rolling around in bed. After I see them back to remove the bandage, then they don't have to worry about wearing any bandages. It's important to allow for internal healing of the cartilage, and so they would wear a headband at nighttime to again prevent their ear from being pulled at nighttime. But during the day, they don't need to wear anything. But otherwise, all of the internal healing happens after about 3 months, and the external healing happens after a week.